everyone. My name is Rose Johnson, Vice President of Human Resources for United Way of the National Capital Area. And it is my pleasure to join the DC Chamber of Commerce in celebrating this year's Nonprofit Organization of the Year. The Nonprofit Organization of the Year awardee is one that shows outstanding commitment to working in close partnership with the DC business community to provide quantitative benefits of sustained significant contributions to the community over the past 3 years. This organization has shown ongoing stability of management, staff, board, fiscal operations, and community support to achieve the vision and mission of the organization while spending at least 80% of its budget on program expenses. This award honors an organization who is recognized as a leader, demonstrating excellence in the nonprofit community and successfully using its mission and resources to improve the quality of life and business in the District of Columbia. It is my pleasure to introduce this year's Nonprofit Organization of the Year awardee, the Coalition for Nonprofit Housing and Economic Development. The Coalition for Nonprofit Housing and Economic Development creates solutions that address the needs and aspirations of low and moderate income district residents by convening, advocating, and educating diverse stakeholders. The organization has 140 plus public, private, and nonprofit members across the community development field in DC and focuses on affordable housing, small business development, and workforce development. The Coalition for Nonprofit Housing and Economic Development has engaged in developing strategic partnerships, policy advocacy, and small business promotion. The Coalition for Nonprofit Housing and Economic Development and the DC Chamber have been strategic partners and allies for nearly a decade, working together to improve the environment for businesses in the district. Coalition for Nonprofit Housing and Economic Development is a long-standing champion of small and minority-owned business development in the district, with a deep history of advocacy to address the systemic barriers that prevent district residents, especially those of color, from economic opportunity. Coalition for Nonprofit Housing and Economic Development has established the DC Community Anchor Partnership, which last year shifted at least $12 million to local minority-owned companies, creating over 60 jobs. Please join me in congratulating this year's Nonprofit Organization of the Year awardee, Coalition for Nonprofit Housing and Economic Development, represented by the President and CEO, Steve Glade.
Hi, I'm Steve Glade, President and CEO of the Coalition for Nonprofit Housing and Economic Development. On behalf of CNHED's board, staff, and membership, we would like to thank the DC Chamber of Commerce for this prestigious recognition of our hard work and impact. We'd also like to thank the Chamber for sponsoring an awards program like this that lifts up the work of organizations like ours and others. This award not only recognizes CNHED's accomplishments and impact, it recognizes an entire community of leaders who have worked for decades to stabilize neighborhoods and serve our most under-resourced residents in the district. Long before economic growth graced DC, CNHED members worked hard and tirelessly in our communities. And despite the current challenges they face due to a global pandemic, they have continued to protect and care for those who are most vulnerable in amazingly creative and responsive ways. We want to thank the Chamber's 3 members who nominated us for this award: Harold Pettigrew with the Washington Area Community Investment Fund, Marie Johns of PP Lethbridge, Calvin Smith with Bridgepoint Health Systems. We would not have received this award if it weren't for their belief that CNHED was worthy of such recognition. To Harold, Marie, Calvin, and others in and close to the Chamber who believed in us, thank you. We also acknowledge Margaret Singleton of the Chamber staff who work closely with our DC Community Anchor Partnership. CNHED's DC Community Anchor Partnership, which works with area universities and hospitals, is one of the reasons we are being acknowledged. So to that end, we have to acknowledge two partnership champions. One is Ward 5 Councilman Kenyon McDuffie, who not only funds the partnership, but also promotes it with potential new anchor partners. The other one is our co-convener, the Office of the Deputy Mayor for Planning and Economic Development, and its leader, Deputy Mayor John Falchecki. The anchor partnership would not have the reach or impact it does without these two leaders' unflinching support of the initiative. And of course, the anchor partnership would not be possible without the dedication of the anchors themselves. Over the last year and a half, these institutions have tripled their spending with DC minority firms through hard, intentional systems change in their institutions. These institutions include Georgetown University, Sibley Hopkins Hospital, Children's National Medical, and Bridgepoint Health Systems. They have each been amazing partners in this journey to access more procurements from minority firms in DC. I'm delighted to say that George Washington Hospital, University of the District of Columbia, and Kaiser Permanente have recently joined the partnership, which will now result in even more business opportunities for minority firms in DC. Lastly, but certainly not least, we thank our funders, old and new, who invest in our work broadly and the anchor partnerships especially. It would be a mistake not to mention our long-term funders, which include the Meyer and Capridge Foundations, and others which I don't have time to name. To all of you, we are appreciative. And our DCAP funders, JP Morgan Chase, Wells Fargo Bank, City Community Development, Kaiser Permanente, and of course the Council of the District of Columbia and DEMCA. Thank you so very much for this humbling acknowledgement of CNHED's efforts and impact. We are excited to continue this work as the district works towards reopening and recovery.